Some rapid tests for COVID-19 that were used in Mecklenburg County could have given the wrong result. Of course, that is very concerning news to hear. Well, it's one that the county has actually issued a warning about tonight. Our Joe Bruno has spent all night finding out everything he could about this, and he's live with the details. Joe?
Scott, this clinic off of Tuckasegee Road has been offering non-FDA approved COVID-19 tests for days. The chief medical officer for this clinic isn't making any apologies for it, but tonight, in the past few hours, Mecklenburg County has issued a warning that these tests may be doing more harm than good. Off Tuckasegee Road to the right of a Wendy's, you'll find StarMed Family and Urgent Care. There's a tent outside for COVID-19 screening with results promised in 5 minutes. But the tests this clinic is administering are not FDA approved. StarMed even says so on their website. Mecklenburg County didn't call out the clinic directly, but we know the type of tests StarMed is offering are the same ones the county said are potentially flawed.
There are some tests, that have gone through a lot more scrutiny, that are FDA approved, that have been validated, whereas others that are not FDA approved or just haven't had that scrutiny and may provide that false sense of security.
County Medical Director Dr. Meg Sullivan says there are a couple issues with these rapid non-FDA approved tests. First of all, the tests may not be very sensitive, meaning it might not be able to pick up COVID-19 early on, resulting in a false negative. Whatever the results say, the North Carolina Department of Health and Human Services isn't even accepting them since the test isn't FDA approved.
For a non-FDA approved test, that's not a reportable infection. And I don't want people to think that they are now safe from getting COVID again.
So given all of this, why is StarMed offering these tests? Hi, doctor. This is Joe Bruno from Channel 9. How are you? I got the clinic's chief medical director, Dr. Aaron Piramzadeh, on the phone tonight and asked. This test you're offering now, it's not FDA approved. It's not even accepted by the Department of Health and Human Services. Why should people trust it?
Because it does work.
But how do you know?
Because they've done the studies on it in other countries.
He sent me that study he's referencing. It's from China and involved less than 100 samples. He stands by the test and said he would take one himself. Why even risk it? Why not just get an FDA test? Why should people take a chance on this test that hasn't gone through the scrutiny?
It's actually a good question, and it's a very simple answer. There aren't enough of the swab tests out there.
But now he says FDA-approved tests are coming. They'll be here by next week, and it was always part of the plan to switch to them. Dr. Sullivan says if the test comes up positive, one potential issue is this test isn't specific to COVID-19. It could pick up other strains of coronavirus. It's a finger prick test that this clinic is offering. That's different from the FDA-approved nasal swab, which is that giant Q-tip that's stuck in the back of your nose, Scott.
And we've seen so many people getting those. And of course, whether you have it or don't, what the results are affects your behavior moving forward. So important those are accurate, Joe. And I know you got a lot of information from that clinic, including the discharge instructions they give to patients after they get the test. Tell us more about that.
Yeah, after our phone call, the doctor sent me over several different documents, and I want you to take a look at this one. It has some interesting language for what they tell patients if they get a negative test. It says the test can be negative, especially early on, even if you are infected. Then in all caps, it says testing negative does not mean you are allowed to go out and ignore current curfews or stay at home orders. One of the fears the county has is that somebody will get a negative test and they just won't take it seriously. They'll have a false sense of security, Scott.
And right now, it's still needing to just kind of adhere to those social distancing guidelines. All right, our Joe Bruno live tonight. Thanks so much, Joe. A lot of good information there.